All right, so now that we've run through, especially you PTs that are used to doing manual muscle tests, how much different is doing neuromuscular facilitation than manual muscle tests? Okay, you guys are the ones that have the hardest time breaking bad habits. So if we're looking at Vastus Lateralis, we're checking Vastus Lateralis for neuromuscular function. Keys are make sure that we are not in range of motion. If we test something in range of motion, we're going to get either active insufficiency or passive insufficiency. We want to be in mid-range of motion. Make sure that our force is going in the plane that we want to be going in. So remember, Vastus lateralis is a hip rotator, knee flexor, pronator, so controls pronation. So we need to take them through that plane. Make sure that our hand placement and that we have them in position before we give them the force. Okay, so we passively put them in position, then we give them a very specific force and a very specific plane to test facilitation. So now compare that to what you learned in PT school as far as manual muscle tests. Put them in a position and just force them as hard as you can. All you're going to be testing there is compensation. And you're not testing vastus lateralis versus medialis versus rectus fem versus genu articularis. All you're doing is checking knee flexion compensation. Okay, so all of your positions, so lateralis, medialis, genu articularis, intermedius, rectus fem, make sure that you're putting them in position, you've got the position, and you're pushing them through the plane that we're testing, and you're testing facilitation, not how much they compensate and how hard they can push. Okay. Okay, so now let's talk about, we just saw them do a screen. So we took them through the screen, we watched gait, we watched double leg squat, single leg squat, all that stuff. So now let's break down the single leg squat and compare it to what we see when we're doing our neuromuscular facilitation tests. So most patients are going to have anterior knee pain with a single leg squat during descension or ascension. Descension, right? Okay, so they're descending. They're trying to control pronation, which is flexion, internal rotation, and adduction. So his knee is flexing, internally rotating, and adducting. That's the exact same position that we just put him in to assess vastus lateralis. So if he's got pain in that position during his single leg squat, light bulb goes off. I need to check vastus lateralis when I put him on the table. So conventional thought process would be like, oh, he has knee pain there, so let's change the way he squats. Or let's keep him out of pronation. Let's put a shoe insert there. Let's put tape on it to cover it up. So we don't want to cover up symptoms. Symptoms are great. They tell us, here's the problem. This position is the problem during a eccentric contraction. So we should be smart enough with all of our education and our years of experience to understand that's vastus lateralis, that's gluteus medius, that's TFL. I need to assess that stuff for neuromuscular function. And once I do that and I found out, oh, guess what? He just failed that test and he's got pain that reproduced what he felt on his single leg squat. I reverse that by doing my palpation, reverse inhibition, retest, strong, no pain, get him off the table, does a single leg squat, controls pronation, no pain. That just proved that I did my job. Okay, so that's how the screen relates to what we're doing with our NFTs on the table and why we're not going to do manual muscle tests. So keys, just review keys with your manual muscle test or your NFTs. If you can't put them in position, fail. If they have pain when you give them the resistance, so if we're testing vastus lateralis and they report lateral hip pain, they're probably trying to stop us with TFL or gluteus medius by abduction, which is why they have pain. Okay, so even though it's not vastus lateralis that has pain, that's a fail. So anywhere they have pain during any NFT is a fail. They stutter, they give out, they say, I don't know what you're doing, that's a fail. Okay. If they complain of tightness when you put them in position, they're basically telling you they're going to fail the test. And then right after we fail the test, that's where we go to palpation, and then we immediately redo the same test that they just failed. So now that you guys have got your hands used to the difference between manual muscle tests and NFTs, now we're going to go learn palpations for the corresponding muscles that we just did all of our NFTs for. So we just learned rectus fem, vastus lateralis, vastus medialis, intermedius, and genio articularis. So now we're going to learn palpations for all that stuff. Okay. All right. So let's go palpation. So everybody go ahead and stand up. So we're going to practice palpating the table.